This hearing will be filmed and streamed live. The recording and transcript will be published afterwards on the States Assembly website. All electronic devices, including mobile phones, should be switched to silent. And so, starting with introductions, I'm Deputy Catherine Curtis, the Chair of the panel.
Conotab Mark Labby from the Parish of Grouville, and I'm Vice Chair.
Deputy Helen Miles of St Brelard, panel member.
Constable Richard Vibert, Minister for Children and Families.
Deputy Malcolm Ferry, Assistant Minister for Children and Families.
Donna Marriott, Director of Children's Services.
Andy Moore, Head of Improvement for Fostering and Adoption.
Okay, thanks everybody. And our other panel member, Deputy Porritt, can't be here today. So we have 1.5 hours for this hearing about foster care in Jersey. So, Minister, with Jersey's population and economic dynamics evolving, how is the department preparing to meet the growing and changing needs of foster care in the next 5 to 10 years, and how far ahead do you plan for?
Well, fostering will form part of our reform plan for the whole of children's services. And at the moment, that is a 5-year plan. And we will be looking to improve the service, to recruit more foster carers. And of course, that will be happening in 2025. That we'll be running a number of campaigns to recruit more families. It's a tough thing to do, and I'd like to actually thank all the people who are foster carers. They do, an incredible job. It's not one that's for everyone, and it's not even one for everybody who shows interest when we run our campaigns. When they, I think after that initial enthusiasm, and when they find out what's actually involved, you will have a number of people dropping off, as you do during the training. So it's and I can't overemphasize what a fantastic job those people do in providing a family, and that's the important thing.
Yeah.
It's the fact that it's a family and children don't go into a care home. I think everyone knows that, the more difficult areas are finding families who will take a number of siblings, or families who will care for teenagers. But we are working constantly at improving that service, and perhaps Donna can tell us a little bit more.
Yeah, I think we've done, as part of the reform programme, quite a focus of that has been on the residential estate, but also on fostering, because we need both things to be strengthened. So you'll know there's been a lot of campaigns the last couple of years. We've had one running recently about teenagers, empty nest as well. So the plan, I think, going forward is to try to target some of our recruitment a bit more in the areas where we've got the greatest needs, so that 5 to 11 and then the teens as well. We've got a plan in the reform programme to look at creating a mockingbird project, which is it's quite a well utilised model that they've got in the UK that they've been doing as part of the whole of the reform of children's care in the UK. And they've been providing funding around to create a small, almost like a hub and spoke model of foster care, where you get a foster carer that's really skilled and experienced, and they're used to support the network of another small group of foster carers that sit around them, and you put support around that with like CAMS, psychology support and other intervention that helps to get sort of more strength, more capacity, because that foster carer isn't necessarily got children placed. And they support the network, and there's a respite model. So the carers that are wrapped around them have a carer that come and support them, offers respite. The children have consistency in their care. So that's our plan to start to look at rolling that out and recruiting for that model this year. Because I think our teens is probably our most challenging area really currently. Okay. It's not unusual, I suppose. You've got a small island and quite a challenging to get the right level of care in a small
Because-
population.
The next question I was going to ask was about that there's, we've previously highlighted a lack of up-to-date policies in children's social care. So is this reform programme going to include all the policies and it's part of
Andy,
that?
I can answer. if
do you want to answer?
Yeah, we've
Donna?
got, Andy probably to put more detail, but we've already started that work. Policies and procedures have been something across the whole of the system that we've been working on. So we've had that work in progress since April. Obviously, across our whole system, we have hundreds and hundreds and hundreds of policies and procedures. So that work is almost finished. There's a new handbook that's out at the moment for consultation with foster carers that provides a bit of an A to Z really, and it enables them to see the whole of where they need to go for what the rules are, and also the fees and everything is all included in there. So there's a whole procedure for them in one place. But all of the policies and procedures are nearly written, aren't they? I think Andy might be able to they're more or less there, about to launch now.
Yeah, absolutely. We've got we've targeted the key policies and procedures, particularly around safeguarding foster carers and children in foster care. But also the handbook covers a tremendous amount of areas where foster carers will be made clear to them what their expectations are and what they can expect of services as well. So I would say within the next sort of 2 weeks, the fostering policies will be finished and ready for uploading, about 2 to 3 weeks.
Okay, because I was going to ask about the timeline, but you think it's all going to be complete
Yeah.
within a few weeks. And you've mentioned the handbook, you've mentioned safeguarding. Are there any other specific policies around fostering which we'd expect to see?
All of them, there's loads.
Yeah.
Give some other examples, Andy. Matching,
There's
managing
matching, there's
allegations.
how to manage allegation, there's understanding the role of the supervising social worker, the role of the children's social worker, the policies around smoking, safeguarding, record keeping. It's almost endless in terms of foster carers. They have a lot to do. But the handbook, they've welcomed the handbook, and they've given me some suggestions that they want added to the handbook, which will make it a lot bigger. But I think it's a good thing in many ways that there is clarity around roles and responsibilities.
Okay, thank you. So my next question is, Minister, your department, has your department reviewed fostering practices and services from other jurisdictions? So we're not particularly talking about the UK, such as the Isle of Man, for example, who are looking for people who can spare a few days or weeks at a time to support permanent carers by taking care of children for short breaks.
Yes, I think, I mean, we've certainly had, in my visits to the Isle of Man, certainly had discussions with them. See if there's things that we can learn. I think Donna's recently been in touch with.
Yeah, not
Guernsey as
specifically.
well.
Yeah, not specifically on fostering, but obviously we've just started to build some connections with the Isle of Man and Guernsey from myself with the directors there. So that's a new link to try to share best practice. I think we've got some arrangements in progress about to plan to do some shared visiting across the system around residential. Fostering will be part of that discussion. We've had some link with the regional adoption and agencies and fostering in the UK as well to try to look. I think the short breaks practice has been being reviewed. Generally, we've actually got quite a few short breaks carers. I suppose the challenge we've got is around some children and there's some special needs, I think, that cause more of a stretch on that respite offer. But I think we need to review the whole of our fostering plan really about how you recruit. There's a really large part of work last year and a relaunch of all our recruitment that has had some success. You'll see there's I think 9 new approved carers, which is good in a year in a tiny borough like this, tiny geography like this. But I think you need to start to keep thinking about have we engage the right communities, the different communities there will be on the island that might offer different things for fostering. We need to do a piece of work around that, which is what we've been looking at with the fostering service.
That's good about the discussions and so on, but does the department review practices and services from other jurisdictions as a comparison?
Not to my knowledge, specifically in relation to fostering. We've certainly done that about some of the residential estate. We have looked across the UK, which covers a much broader, obviously it's got a much larger population, which you'd normally benchmark against. I say, and we've started to develop those connections with other jurisdictions, other islands, so you can start to get some similarities.
Okay.
That was actually my question was about sharing resources with others, especially perhaps our sister island, Guernsey, being so close. Is there a thrust to sort of enhance that collaboration?
I think that's the discussions I've been in with the director there. They've obviously got a secure estate, they've got challenges in, they've got shortfalls and challenges in capacity there the same. So I think they're part of those discussions. We haven't spoken specifically to fostering. No.
Okay.
But that doesn't mean we won't, because it'll be, I said, as we start to collaborate, we'll start to consider lots of shared practice areas, I think.
Sure, and sharing successes and
absolutely.
improvement and measures such as that.
Yeah.
Okay, well, thank you for your honesty there. How does the department ensure emergency placements are handled in a way that minimises stress for both children and foster carers while providing necessary support?
Do you want to do? Yes.
So I suppose firstly you'd always try to avoid emergencies where we can, so trying to be more thoughtful, preempt, think about having good planning helps. We're not there yet. Children do obviously always come in emergencies sometimes. Part of that is trying to make sure that the social work teams are thoughtful about the child's needs, that the communication happens with carers. So we've had a couple of incidents lately where I've actually been out in the office or involved in calls where you'll have the whole team on the call, the foster carer, the foster carer's fostering social worker, the social worker, the manager from the team, and that's the best way to do it because that'll help to prepare that placement happening in the best way and make sure the carers are supported, they have all of the information, and that they're ready. I think some of the criticism has been historically that we're not always been as good at that. So part of the work we've been doing is trying to make sure that's much more joined up. Part of that helps to have the fostering handbook because that helps carers to be clear about what the offer's going to be and what the information needs to be. We need to be stronger at information sharing with the foster carer, and that work's been happening, I think, with fostering in the fostering supervising social workers as well. So work in progress, but starting to be more joined up and seeing that as a whole team.
So avoidance and planning is something critical, yeah.
Yeah, and I think communication and information sharing really critical, and the thing that I think carers will sometimes say we don't get right, and the thing that we need to put our effort and energy into. So the policies and procedures, the handbook. We've started meeting with foster carers as a group to learn from them about what doesn't work. There's been a survey recently about them sharing about the stuff that we don't always get right and we could do differently.
Sure.
And how to make them come to the fore of that a bit more, I think, in helping us to see it.
Okay, thank you, Chair.
Thank you.
The foster carers have helped us with that survey, haven't they? Yeah, which is good. So it's a survey where there's been collaboration, and I think that's a good sign.
And a lot more, I think, Andy's been meeting with all of the foster carers and the Foster Care Association, so I think starting to use their experience to help shape some of what we do. So there's been quite a lot of thinking about a lot of that.
Okay, thank you. Just a really straightforward question. How many current foster carers have you got?
What's that? Current, probably need Andy's current.
Currently, we have 31.
Yeah.
31.
Is that kind of 30?
But that's a mixture of foster carers who can look after children long term, short term, and only respite. We have quite a few respite carers who will look after children up to a week at a time.
Okay.
So we're actually quite limited on placements for children that need longer term placements.
So
but
when-
we have got 31.
So when you say you've got 31, is that foster families or
Household.
that's households?
Households,
Okay.
yeah.
31 hours.
Because obviously if you've got kind of two partners in a household, that you still count that as one, not two. Okay, thank you. You've talked a little bit about the strategies that you're implementing to increase and encourage carers to remain in the system. You've talked about procedures and processes, handbook, etc. Just a silly question: is a handbook electronic or is it kind of a book?
It'll be online, won't it, later on? But at the moment, it's
It's currently a Word document at the moment. Once it's been signed off, it will become a procedure online through our Tri-X company that we use for policies and procedures. But people we can print it off for carers if that's what they want.
Okay, but otherwise it's dynamic. They can.
So we've just procured in, I don't know what month it was, but not long after coming, so maybe May, we procured Tri-X, who's it's a company all across the UK, and probably the islands use them as well, that do online procedures, and it basically means that you can get a much better quality procedure that people can access for all of our procedures, but they're updated regularly through that.
So
there's a system for it.
So the handbook, the procedures, the processes, are they public?
They will be. I think we will make our Tri-X open to the public. Yeah,
So the public can see, and equally foster children can see what
so
they're.
we have got separately a piece of work going on to start to look at a website for the department, and that website will, with part of the work we're starting to look at, is that being about a child's friendly part of the website that young people and care leavers will be able to go on and access.
Yeah.
So we will build that, but it will take time.
Okay. I think for a lot of us that have been around in Jersey a long time, the retention of foster carers has become an issue. How are you coping with kind of the legacy issues and the reputational damage that's been done to the fostering adoption team, which are actually putting people off coming forward? So things like the lack of support, the constant change of social workers, not getting paid. Jersey's a very small island and these sorts of things go around. So what are you doing to kind of tackle those sorts of issues?
So do you want me to?
Yes, I mean, we've got some very positive things as well.
I think that is there, and I think part of any improvement programme anywhere, you have to sort of rebuild trust with the system, and that's certainly been going on. I think the last year, from what I've seen, with more connection and more involvement with carers, and I think that's critical. So the work that Andy's just started in the last few months to now set in train a process where we'll have a better interaction, meeting much more regularly with foster carers, hearing their views and rebuilding trust, then that builds reputation significantly, being clear, having ownership of things about when they're not going right, and making sure we put things right if there is an issue.
Okay, thank you.
I think will really help foster carers to rebuild trust, the same as children.
And just to build on that, Deputy Miles, so from a political point of view, the Minister and I meet with the Jersey Foster Carers Association on a quarterly basis to hear their concerns and take that feedback back, as well as, of course, to thank them. But what we did directly 2 weeks ago is we met with the senior leadership team and frontline staff, and both the Minister and I went out on personal visits. And, you know, we're really grateful to those young people for opening up their lives to us. But we saw firsthand what the challenges are throughout the system. So across children's social care, across fostering and adoption. And that was a really valuable exercise for us to understand how it works on the coalface and what the challenges are.
And we're going to be doing more of that throughout the year.
We've got them booked in senior leadership.
You talked briefly about diversifying the fostering community, trying to recruit individuals from kind of hard to reach group, different demographics, etc. Have you got any specific sort of examples of how that's worked well?
We haven't started that yet, but it's in the plan for us to do. So we want to try to connect with some of the communities, like the Portuguese community. Mm-hmm. We've got some discussions about some of the perhaps church communities. So that's the work we've just been modelling up now about and started to look about how we might best be able to do that and through who are the best connections.
I mean,
to
you've mentioned church communities. Is there any work going on around sort of broader community and third sector organisations?
So that's part of the. So we've just started to connect with a couple of people across different parts of the system, like some of our charitable sector. So I think that's what we'll create, and we'll build that probably with the foster carers as well. The plan for recruitment across the system, and we've just put some extra comms capacity into the service that will help us to think about how we might do that well.
Okay.
How to sort of target some of the communities we don't think we're properly connecting to, that would reflect our population, our child population.
Thank you. Have you got any initiatives as well, partnerships with sort of local businesses that would be, you know, in allowing time off for fostering emergencies, for, you know, settling children in, etc., etc.?
We haven't done that yet, as far as I'm aware, but certainly would be something we've started to, through the work in the Children in Care and the Children in Care Council work we've created a subgroup under the Corporate Parenting Board, and there's one in there about participation across the system for children, and we're starting to engage different parts of the island in some of that work, and I think that will provide us a good space about how we can connect and get the right people at the right.
Yeah, and also, sort of, has there been any exploration of sort of local businesses and partnerships offering kind of discounts to foster carers?
Well, we've got some of that. There has been, yeah.
You know,
certainly.
to certain attractions
Yeah,
and things, active cards and things like that.
They do have a active card already, or sort of, for some of the things. Some of
So they want to do, so that would reduce. Okay.
We already pay for some of that as well as part of their offer.
And the last question I had on this is, it's a bit out of kilter, but we didn't have it in the question plan. Any plans for bail fostering?
Yes.
Because we've been trying to get bail fostering for about 25 years.
5-year plan.
In the 5
There is,
years.
yeah, we are looking at both an emergency. So you won't have seen the plan yet, the improvement plan, but in there's a proposal that has been agreed actually by Com that will have an emergency bed, and that emergency bed we are suggesting that will probably work as a remand bed as well.
Okay. In a home as opposed to a children's home.
Well, it will be a children's home, but we are looking at being a fostering and a residential by arrangement, that we will come up with something. So we are just about to have conversations with the JCC about registration and what that might look like.
Okay.
So that knowing the economies of scale we have on the island,
Exactly.
and the volume of foster carers we have, expecting that you'll have a foster carer available 365 days a year may be a challenge. So we're thinking that the model we want is to have a site-based model that has resilience in there for a children's home, but the home is left, it's not open all the time. So it would be purely for an emergency bed and a remand facility. And we might be able to have an arrangement that's joined up with fostering and residential. We can make it doable to make it work. So there'll be a family type arrangement.
Good luck with that. Okay, thank you.
Just asking some questions now about financial support. Minister, the panel understands that there were discrepancies in the 2023 allowance adjustment provided to foster carers. Can you tell us about this and advise if the government will commit to addressing the shortfall retrospectively?
I don't know that.
No, nor do I.
So there was a 7.9% increase in the 2023 allowance over the 2022 allowance, to replace it with a 10.4% increase with retrospective application. And we spoke to foster carers who talked about how some had not been paid expenses for approximately 6 months. There was several issues outstanding over payments.
So
No,
I don't know
we'd have
that.
to come back to you on that,
So I think
because that's,
we probably would need the detail, so we're
we'd
clear
need a
about
lot
the
more
query.
detail on that.
but it's not something I'm
Yeah.
immediately familiar with.
Okay. All right,
It
so
will come to my attention.
you'll come back to us on the
Individual cases we gladly hear.
We'd need some starting point to look at that, because
Yeah.
we'll have to ask you to.
Okay, because I've got the information there about the change in the increase on the allowance and with retrospective application, so there's that part of it. So presumably people would have been expecting to get paid an extra payment after that.
Not familiar with.
There's
It's unusual because you have an uplift fee at the, so you normally set that at the start of the year about what the uplift fee is. That's normally runs in with your, whether it's GDPI, whatever it is, it'll go with your, whatever you have. I think from my understanding, I think everything we've had where there's been a query or a concern about payment or a dispute about that I thought we dealt with everything.
I thought so as well. So I think if it's possible, if you can ask somebody to contact us directly, and we're happy to look at that. But it's not something that I can say has been raised with me or the department. Nobody's.
Just looking at the notes I've got here, there were also concerns around payment delays, and the reasons have been given as systems errors. And sometimes people were, apparently the responsible person was off sick or on holiday, and this seemed to be quite a problem. But we'll perhaps.
So I think we can answer that.
Most of the payment issues, and I think this needs to be understood, most of the payment issues are not we are not responsible, our staff are not responsible for those. They are central government issues with the payment system. Even the last one that we had, the 1 day delay, was not our staff who were responsible for that.
But they're responsible for dealing with the fallout, though,
yes,
aren't they?
and I've got to say they acted very quickly on that.
And we can't really expect the foster carers to subsidise all the costs from their own.
No, and we wouldn't expect that. But I've got to say that our staff are good at reacting to this, and I can't speak more highly of the staff. When they're dealing with something that's actually outside of their control. They do, I have to say that certainly the last time they reacted very quickly to that.
Okay.
Yes, Donna?
I think there have definitely been systems issues that do impact. There's been a piece of work that's been happening for quite a few months now to look at the payment system to create a bit more sustainability and autonomy to it. That work's been done, and I think all of Andy's staff have been trained now in the new system, and in April a new system will roll out where it's much more automated and it'll take away some of the options for errors that there's been. I think my sense is, from what I've seen, is that when those errors happen, the team have tried to act quite quickly to try and make sure that people are assured that, if there is a problem, we would always, if someone was going to be affected and impacted, we would try to help. I think there have been issues sometimes where we don't always get things quite right, and where payments haven't worked well, and that might be about our own error, but they've been rectified, and I think there's been much less of that. I think the system feels much more structured than what it was.
Okay, so
I think the procedures are clearer, so I think those things are helping.
a better way to deal with any
improving
potential problems like that. But then, as another quick example, we heard about the extra expenses Christmas payment being paid on the 23rd of December, whereas of course people buy all the presents long before the 23rd of December, so it's not very practical if the foster carers don't actually have like a large amount of spare cash of their own. It would be better to pay that much sooner.
Can you answer that, Andy? I don't know the answer.
Excuse me. Yeah, there was an issue somebody hadn't pressed a button because it's off an Excel sheet that identifies when that needs to be paid. And it was brought to our attention. So I totally agree that the foster carers should be receiving that money 3 weeks early. I met with the JFCA on the Monday 2 or 3 weeks ago after the most recent payment issue, and we talked there about how we need to provide birthday allowances earlier and how to provide Christmas any allowances that are additional in good time so that the foster carers aren't using their own money. Absolutely.
Okay, no, thanks, that's good. Now another question. Considering Jersey's high housing costs, has the department considered a separate property element in the maintenance allowance?
Not that I'm aware of, but we have been reviewing fees. Actually, if you look at our fees across the system in a benchmarked way, actually our fees are really good in Jersey, and that's taking account of cost of living being higher here. So when you take all of those things into account, we think that there may be a little bit of the system that probably needs to be looked at, but not really in relation to housing, because your fee for fostering would be looked at in a benchmark way, like anybody's salary. So it's the same as any role. Obviously, it's a much tougher role in lots of ways, but the same as any salary. You try to make the fees work that it would be salary compliant. So that work is being reviewed. We've agreed to review the fee structure and just make sure and see if there is any changes needed. And there's some things that foster carers have asked about things like after school clubs that all need to be reviewed as part of that work. So that work's underway now, along with the sort of specialist fee and things.
And
we're reviewing any additional fees that foster carers get above and beyond the child maintenance that they get, and as to how that impacts upon them as the children and the placement.
Okay, and I know that you mentioned before that the review of policies is going to be ready within a few weeks, but reviewing things like this, fees and so on, when might that be complete?
Is it 3 months with Britain?
Yeah,
Yeah,
we've targeted 3 months.
Great. So, Minister, fostering agencies in the UK provide bridging payments to retain carers during periods without placements. Could Jersey adopt similar practices? And I know that you're reviewing this, but is that part of a review as well? Bridging.
We haven't actually looked at bridging placements. It's not. I don't think it's very universally used in the UK, from my experience. But we haven't got it on the list. But we could look at it. We want to look at making the offer the best we can.
That may help retain some really good foster carers, perhaps.
Certainly look at whether that's an option. Yeah. I think that there are quite a number of issues that come with bridging and availability of placements that would need to think about, especially in terms of sufficiency. I think, when you've got such a small cohort, it might be quite challenging to create a bridging system, but it doesn't mean we can't look at it.
And my last question, actually coming back to the problems with payments, was just how many times have payments been missed to foster carers in the previous year? Do you have that information?
We'd have to get that.
Yeah, we'd have to look at that.
Yeah.
I certainly haven't got it to hand. And I mean, there have been a number of incidents across government where there have been issues with payments. So actually,
just ending up in petty
a
debts.
definitive answer may be challenging.
Right, okay, because also this data is not captured centrally in any way by the look of it.
I didn't know that.
Well, it wouldn't be captured by us because
Would it be the Treasury?
Maybe
it would be within the Treasury, possibly.
Do you have a single point of contact in Treasury who deals with any issues that you have over payments to foster carers?
I think my sense is that we've created, there's been much more join up over the last months with Treasury and the system people as well, trying to create something that's going to be more consistent, I think. So that's the whole thing of that move to the Treasury, to the automated system. So there's definitely links, because I get copied in when there's an issue, and there definitely is. That's not just a generic inbox.
Okay.
But I don't know if we've got a specific key person. We could ask that.
Okay.
No,
right.
I think the nub of this questioning and the thrust of this questioning is all about retention and foster carers within the system that have expressed concerns to this panel certainly are concerned about this issue in particular. So why we're asking these questions is it's been highlighted to us. So it's very important that perhaps the department really looks at this and hopefully you will be in. Most of my questions have already been answered, but there is another one I'd like to ask about the financial side of it. Can you advise the panel on your opinion regarding pocket money allocations provided to children in care? Because the panel understands that some foster carers would like this to be discretionary.
First I've
I
heard
don't know the answer, because
No.
I haven't heard that.
I haven't heard that either.
Okay. Andy, do you know the answer?
I would need to check, but I believe we've put it in the handbook as to what the level of pocket money should be, the child's maintenance allowance.
Okay.
I think some of,
Discretionary in what way? The amount
Well,
or the payment?
I think
or-
some concerns were that some children knew what the pocket money element was supposed to be and would say, this is my right
It's
to
an
have this
entitlement,
now.
yeah.
Whereas the foster carers might want to spread it on, buying a larger item next month or something, and the children might.
So that should be
Positive
part of the
reinforcement for
placement.
behaviour.
That should be part of placement planning, really, and that should be agreed with the social worker.
Yeah, and they're all going to know what the pocket money allocation has been in the handbook.
Yeah. No, it's just something that's been, not maybe highlighted to us, just we are concerned about retention, are we not?
Yeah.
And this is part of the problem.
Yeah.
Not that pocket money in particular, I'm just talking financial.
Yes, yeah. I think one mustn't let the financial sort of element detract from the excellent work that staff actually do. And I don't think they get the credit for the because it's as well as foster carer being tough, that it is tough for the people actually working in the department, because they are always looking at the best interests of the children, and I think we have to tell them what an excellent job they do as well, albeit that there are problems with the financial systems and things do. I mean, we're not perfect, and we know that we're a long way from there, but we are improving.
Thank you for your honesty,
Yeah.
Minister. Thank you. Thank you, Chair.
Thank you. It was just to ask some questions around training and support for foster carers, and I think you've alluded to some of it already. Children are being placed who have increasingly complex needs, and foster carers really require some specialised skills. So what sort of training programmes are being developed to help foster carers handle these challenges effectively?
This would be better picked up by, I can talk about it, probably be better picked up by Andy.
Andy
She's
would probably,
got
yes.
most.
Do you want to
She's
start,
done
Andy?
We've done quite a lot around training,
Yeah.
but
I've just found the foster. If you want to go back, the handbook is very prescriptive as to how much pocket money children should receive at different ages. So, for example, 11 to 15, the weekly amounts, the 2 weekly amounts are £25.78.
I have to say, I think there was always quite a lot of discussion about money, but some of the stuff I've seen here is the best I've seen in terms of the generosity. It's not a poor.
I think the question wasn't around the amount of money. It was whether foster carers could say, well, actually, do you know what? Your behaviour hasn't really been, up to scratch this week in a way you do with your typical child. It's actually, I'm not giving you your pocket money this week. How, because that money is allocated by government, as it were, how does that affect the dynamic with the behaviour maintenance with the foster families?
That's about making sure that they're clear about the plan for the child, and their team, foster care, the social worker, are clear about how to spend it. And you would want to use pocket money in a way that's
Positive reinforcement.
It is a positive reinforcement, and if things aren't going how you want, you would want to be able to withdraw it. So that should be happening. Foster carers have got the ability to do that, as long as the money goes on children. So you might not give it them the pocket money that week, but that would still be their pocket money, so
Yeah,
you think
still
of
be
that. So, you know, that the foster carers have got the ability to work in that way, haven't they, with their supervising social workers?
Yeah.
Yeah, okay, thank you. So, sorry, Andy, back to you regarding the training programmes for more complex needs.
We have an extensive, I think our offer of training is a really, really good offer. So we offer a mixture of mandatory training as well as, sorry, I'm in the wrong document, as well as a number of, bear with me, sorry, I'm trying to find a document.
It's, yeah.
So we have, as I said, an extensive training program. So the mandatory training covers record keeping, safeguarding, managing allegations, safer carer, and paediatric first aid, and that has to be. We've changed that. That's got to now be renewed every 2 to 3 years on different ones. So, for example, first aid is every 2 years.
Andy, it's more complex for the
complex
children,
needs,
I think, really, that Deputy Miles is more asking about. So the complex developmental trauma.
We have understanding neurodiversity and disabilities. That's a specific.
Okay. Well, in addition, there are a number of specific training courses, such as understanding attachment disorder, helping children make sense of their past, hypervigilance, disassociation, ADHD and conduct disorders, adolescent mental health.
Can I just ask the question then? If you have a child that has ASD or ADHD or an attachment disorder, how do you ensure that the foster placement that you place that child in, the parents have had that training? Is that training mandatory before you place the child in that setting?
No.
Mandatory? No, it's not mandatory. If carers are interested in caring for their children with additional needs, we would expect the supervising social worker to make sure that they are ready, they are already trained within that process. We've also just recently have the LAC, Looked After Children's CAM service, who we're working closely with the specific service manager on that, who is going to do some trauma-informed and specific training with carers. And then we're looking at meeting with them on a monthly basis as a reflective supervision, really, with the foster carers.
So as the current situation stands, it is perfectly feasible that a child with a particular need could be placed in a foster placement where that specific training hasn't taken place. Okay, thank you.
Yes.
And presumably your plan is to minimise the impact of that through training.
So the new work around fees includes the looking at that more specialist level, and it needs, what we're saying will need to happen across the whole fostering system is that the fostering offer, the payments and the structure needs to be driven by children's needs and the matching around children's needs, and making sure that the carers have the skills and the ability to meet the needs of the children that we're placing. So some of those things will come together, I think, much more, combined with the CAMS offer that will overlap. So where we've got a shortfall in a skill, that CAMS team will be able to start to help the carers develop the skills as well.
Can I just ask as well, around training, when I did this a few years ago, we also did what was called the Solihull training. So we had to do quite a detailed course where we evidenced through examples of work we've done in specific ways. So is that still there for foster carers or something similar?
The Solihull is normally part of our early help offer as a rule.
It's not.
So
You've got New Forest as well that you offer parents.
It's not within our training programme.
I think we've had the New Forest, haven't we, as part of it?
Yeah.
Okay.
But the Solihull's more of a, it will be available, but it'll be in the early help offer for much more broader range of professionals, rather than only foster carers, because it's a kind of lower level, broader course, if that makes sense, sort of more generic in its application.
my next question's around support for foster carers, and we know that foster caring is a really stressful job. The fact that sometimes foster carers will be receiving children for which they haven't had specific training actually kind of increases that stress level as well. What resources are being provided to foster carers to ensure that they do get a short break service and that their mental health needs are being met?
So,
Andy, or
Andy, I can't.
Part
It's quite a
of the placement planning with a child, there would be a discussion around levels of respite care that are needed, if they are needed at all. Our short break service is only a short Saturday 3-hour session that we offer for children with complex needs. But for children within the placement, it's often where a carer says, I need to go away for the weekend, we will arrange respite care, or it can be part of a consistent package that's put together to wrap around that carer once that child's placed. It's all about the plan at the start. And I think one of the things I think we've learned very quickly is that historically we haven't been very good at matching children with foster care, and that's led to quite a significant number of placements ending unsatisfactorily, and also care leaving. And I think we're getting much better at saying, no, we haven't got the carers to meet this child's needs, and therefore, we need to look elsewhere. But where we believe we can provide a package, we put a whole wraparound service around, and that would include respite care.
I mean, you've said there, just thinking it from a foster carer's perspective, if that service isn't there, you've got to look elsewhere. Where is elsewhere in Jersey?
It would be residential.
Yeah.
Or it might be off island if we had no placement. But that would be court endorsed or family endorsed.
So if, for example, it was residential in one of your existing homes with short break service, would that displace children that were there for short break services from their parents, or would that never happen?
So we've got a finite resource, as you'll appreciate, and part of the reform programme and the improvement programme is trying to look at how we make a more sustainable, longer term offer that can meet more children's needs, because we've obviously got an uplift in need across the system. That'll take us time to build. There will always be a draw on placement activity, whether that's respite, special needs, whether that's children, teenagers. So I think the system requires more capacity to be built into it. We wouldn't, we'd look across the whole system at what we've got, and I suppose you would try to meet need as best as you can. That might mean that some families don't have as much or as they want or need. It might mean that some families have to wait for things, and that's hard, but we have to work within a system of a finite resource that we have.
Thank you.
But hopefully the reform and improvement programme will help to, certainly
Increase
our
that
residential
capacity.
offer will be much better. We've got work going on reviewing the whole of our short break offer, and how we can make that more extensive, so that over the next sort of 5 years, the next year, the short break offer will be reviewed.
Okay, thank you.
Will help us to offer more and cover
Thank
more
you.
need.
Can you talk to us about what immediate support mechanisms are in place for foster carers who are managing a crisis, such as, behavioural incidents or placement disruption? What out-of-hours support is available for them?
Us to go. So we have got.
Thanks.
We have got.
I'll just say with you carry on.
Go on, you go.
We have a specific fostering support out of hours team who is a helpline and will respond if necessary to go and visit, in addition to the normal out of hours service. But I think you'll find that we find that if there are issues, our supervising social workers will work weekends. They go and support families. Most recently, just for example, we've had we're moving a child from one placement to another, which has been a really difficult process. And the social worker has been working evenings and weekends to support the placement to make sure that transition is smooth. In terms of other additional support, In emergency, I think with the new CAMS officer coming on board, where children are struggling with their emotional health, we've got direct access into that, and we can access that resource quicker. And we've just had an example where, after speaking to, it was actually an adopted parent, who was going to go private with the work because she was told by CAMS that she couldn't access the service. We've expedited that, and she's now getting the service through CAMS. So we are beginning to really wrap around and use our partners to make things better for carers, I think, when there's a crisis.
Okay.
We also build, as you said, we talk about respite as well. If there needs to be a break, we will look at using our respite carers.
I think one of the feedback we've had quite recently from the survey that foster carers have done was to say that actually the out of hours offer, they value it. It's unusual
really
to see a
value
fostering out of hours offer, actually. I haven't seen one before.
Okay.
So to be uniquely fostering, only an independent fostering agency. So
Yeah. Okay.
they
thank
clearly
you.
value it. They
do, yeah.
Yeah. Thank you.
Okay.
It is I. The next part is about communication and engagement. What training is being provided to social workers to create a better relationship with foster carers, and how is accountability for poor communication or behaviour being addressed?
Yes, you do,
quite
Donna.
a lot of detail today, quite close detail. So as part of the reform programme, the improvement programme, we've got a big piece of work about the model and practice. Now that practice model, the Jersey Children's First Practice Model, has been quite, I think I spoke to you the other day when we were in the panel, but it's been quite a theoretical model. And what we're saying is it needs to be much more embedded in reality about, and a central part of that is about bringing the team together around the child. And it really, it sounds the most simplest thing that you would not put any weight to, but it is the most critical bit of practice. If the team come together around the child, which is the foster carer, it is the social worker, it is the fostering supervising social worker, together the communication will be better, the information sharing will be better, and we'll make better plans and decisions for children. So it is a really critical part of our practice that we're really trying to drive. There's been a real focus on that. We've just brought the whole of the directorate together last week to look at that. They came together to look at the model itself. We're rolling out that practice across the system. We've started the work with Andy's meeting with the foster carers, that we're going to a senior leadership team, but also the heads of service from the social work teams will be attending those meetings with the foster carers because they have oversight of the social workers. And that's about trying to bring communication together better, to bring the team together to make sure that there's not those opportunities for communication not to happen. So things are more joined up. So I think a lot of it's a leadership and a cultural shift in expectations and standards that we have to set from the top. And that's about having the leaders at the right places to get the social workers and seeing it's important, and holding staff to account to make sure it happens is a really critical part of that. So setting standards is all part of that practice model, and setting expectations and holding social workers to account. You know, it is a challenging job being a social worker, and they have 1,000 layers every day that they're trying to juggle. And often they'll see those children as being safe and well cared for in a really good home, and they'll be worrying about the other bits of juggling their job that isn't safe and isn't the same. And we've just got to get them to try and see across the whole, really, about how they best manage all of those demands, and make sure that we give the messaging as leaders that fostering and foster carers are important, and that communication support. So that we've had a lot more work in the teams about matching, much more oversight from managers about matching, because that's often where things are more challenged. They don't happen so well. So a lot more around that. We've had more focus on the independent reviewing officers, making sure they're holding social workers to account, making sure the escalation processes are followed properly. We've had a lot more focus the last 6 months on visiting children. That includes children in foster care. So those things will help to drive practice. I know that visits to children have improved. Visitors to foster carers are improving. They've improved a lot. So we know those things are starting to happen more. And as they do, we could be much more confident that the communication will come together with it, as it should.
That's crucial. And the communication with the Jersey Foster Carers Association itself, how do you communicate with them about potential and upcoming changes facing the sector?
We meet with them every quarter. Yeah, and that will be part of those discussions. And you know, I hope that they know that they're quite free to raise any concerns with us. But there's, you know, two-way communication, and in fact we've those quarterly meetings. I don't think were happening historically. I'm very keen on that.
And I'm sure any feedback that you get from those
Yeah.
very important meetings could and should perhaps be incorporated into any policy changes or into the handbook.
Well, they will be, yes.
They get feedback is so crucial from them. And they're...
Can I?
Yes, sir.
Yeah.
Sorry.
I'm also meeting with them on a monthly basis now. So we've set up our first monthly meeting at the end of this month, and then from then on, we'll be meeting monthly with the JFCA. Again, as you said, to look at any policies, any issues that will then feed into the quarterly meeting with the ministers as well.
And that would include things like out-of-hours support and all these sort of issues.
Yeah.
Minister, the panel understands that this new handbook, which we're very keen to see a copy of, was expected to be launched by the end of 2024, but it hasn't yet been. Can you confirm to the panel why this hasn't happened and when we're going to see that copy? Can we have a timeline, please?
So the handbook's currently out with it's out with the JFCA.
Yeah.
And with all the
Foster
foster
carers
carers, it's currently out for consultations. We're just waiting for feedback. So what's the deadline we've got? Is it the end of February, Andy, for the feedback?
Yeah.
End of February. Thank
So
you very much.
it'll be launched in March as soon as we can take account of the consultation feedback. It'll be out.
That's excellent. Thank you.
And we can share your copy.
Great,
Thank you,
Yes.
Chair.
thanks.
Thank you very much.
I just have a few questions around operational challenges. So about supervising social workers, communication gaps with supervising social workers are reported to be a recurring issue. What specific measures are being taken to ensure foster carers receive consistent updates and timely responses?
I think that will be addressed by the new. So I don't know which specific issues that you're referring to, but assuming that's a more generic worry of carers that you're saying. I think last year historically there has been quite a lot of change in the service, and I think that's been quite challenging. Across the system, across children's services, and that's been quite challenging for staff and foster carers and carers in general. Part of some of the actions we've taken to try to bring stability that helps communication has been to create the fixed term leadership team so that we create the foundations for something more stable across the whole of the children's services, which will help. The fostering social workers have been allocated to the permanent fostering social workers have been allocated to foster carers, as I understand it, that will create more consistency for foster carers rather than the recruitment stuff, so that they get more consistency in their workers, which will help communication. The creation of the handbook, the policies and procedures, quite a lot of issues have been about communication and clarity about fees, standards, issues, agreements. So bringing in a better structure around the rules and the expectations will really help make communication work better. I'm confident of that.
Because that's, I think, what I was thinking of more with structure. I know when I was a foster carer, I had some really good supervising social workers, but I don't know how much it depends on whether you're lucky to have a really good supervising social worker. So how much do foster carers know to expect from their supervising social worker? You know, so will this be in the handbook? that you should definitely have this many meetings and
Yes.
so on, and
Yeah,
all this sort of
it
support.
is.
Yeah.
It is. It outlines there very clearly about what it outlines there about the expectations of foster carers, but the expectations of the department that foster carers can hold
Yeah.
the department to account for. It's a two-way handbook.
It was brought up at the Foster Carers Forum, wasn't it?
It was.
And they've asked for it to be written into the handbook prescriptively, how often they should be visited, what tasks they have to do over a year, what's the role of the children's social worker, how often should the child be visited. So it's going to be very, very prescriptive, and they can then hold people to account.
That's good.
I think that'll make communication work
much
better.
better.
Yeah.
And also then when it's not working for you, you can raise it with the manager, it can come to Angie and we can hold people to account to say we're not delivering on what we promised.
That's good. There's still high turnover though among social workers, which leads to instability for children and foster carers. What strategies are being developed to reduce turnover to try and ensure consistent relationships?
It's a difficult one because there is a shortage across not just Jersey, the UK,
UK-wide.
and that's part of the issue. Of course, with Jersey comes the complexities of accommodation and Donna, you can probably
So we've just
expand a bit more.
so as part of the improvement programme, some of the work mapped into there is about really the whole workforce, residential but also for social workers, really big part of it. So there's a range of things we've put into place in there, the Grow Your Own scheme of social work, so bringing people up through apprenticeships and through the system. We've done some work to try to strengthen that will help the offer. So we've built that into the reform improvement plan that's COM have signed off. There'll be some extra investment around some of that to try to forecast forward that we get more social workers in the system that we train and develop here on the island and they're part of people living here.
Have you got the practice supervisors within your existing children's service to be able to support the apprenticeships?
So we've built the programme in a way that won't start this year, recognising that we're not in the place yet to have the level of practice supervisory capacity where we want it to be to really drive that well. So that's forecasted forward a year.
26.
The end of 26, there'll be September they come in, I think it is.
Yeah.
So not this year. We've got some people in the system already.
Yeah.
But we've made a commitment not to do it this year because we need to get the service in the right place that gives the best start for those practitioners.
Okay, so we'll be looking at 29-30 before, when they've done their post-qualifying year, so it'll be 2030, the cohort.
Yes, but we have got some people in the system already. We've got the on-island degree. We've just been working with Social Work England about some of the on-island degree to make that work a bit more smoothly. We've just been looking at the retention payments around social workers and built that into the improvement plan. I think it's not only about money and terms and conditions, it's about what we offer as a leadership team and the stability and the leadership that the workforce have to do their job and they feel held and supported. That's why we brought in a new team of leadership team to hold that. So there is extra capacity in our leadership team than what we might ordinarily have, recognising that we've got work to do and it needed some extra capacity to hold it. That will create some stability. I have to tell you today, I'm hoping today, certainly last week, we had all of our team managers in permanent posts for the first time. We've got the leadership team in a permanent fixed term arrangement properly. So everything from that team manager up is in quite a permanent and stable point for the next 2 years that's going to hold the system. That will make social workers come and want to stay because they'll be held and supported and have the right conditions. And that take us time.
So that's really good that all the team managers in permanent
I'm
posts.
crossing my finger because something might have changed since then. I'm saying a little caveat to that. But they were
Past 10
when I
on a
was
Friday, you never know.
It might, but
At this moment,
it might look different from when I was told a week and a half ago. So there is a bit of a caveat, but yes, we have got some stability, and the turnover's probably held at the moment, and we have had quite a lot of success recently. We've had some of our agency staff transferring onto permanent arrangements. So I think ask us in
Green sheets.
maybe 9 months.
And that's
See
good.
where we are with
I-
that turnover.
And so just a comment, I expect that it must be quite difficult for permanent social workers to perhaps see agency staff come in and seem to have better pay or conditions than
Absolutely.
themselves sometimes, so that doesn't help for retention
Yeah.
either, does it?
Hard.
Yeah, okay.
But some of that is the offer. So I think, as I've been saying to the agency staff and to our permanent staff, that if you come and you commit to being here, you get the conditions that come with being in a permanent employee that agency staff don't have. So I get my pension, I get my support. If I'm sick, I'm supported. As an agency worker, you do get paid more, but you take a lot of risk and you have none of that arrangement around you.
Absolutely.
And so that some people will make that choice, but it doesn't necessarily mean it's the best choice just because it's paid better.
Okay.
Because it doesn't always come with the stability that you want.
Yeah.
And we need to make being here and being permanent the thing of choice, but there'll always be a cohort of it. You'll always want some agency top up in a social work service.
Okay, yeah, of course. Just a slightly different sort of question now about apps. How is the department exploring the use of apps or other digital tools to help foster carers manage records, track expenses, and communicate with social workers? So, is this going to be introduced, and is there a timeline for doing something like this?
Yes, Andy, have we got anything?
We haven't looked.
No, we haven't looked at it, I don't think.
No, I'm aware that foster carers are keen to have iPads or laptops. We're keen as well that they have access to digital solutions where they can just send their records in, or they can access like the procedures straight away. It's something that we do need to look at. We haven't got there yet.
Okay, and I was going to ask a follow-on question about how you review risks changing processes with software and so on, but this is not being looked at yet, really.
It does need to be. It needs to be part of our whole work about bringing things online and all our automation.
It's actually, the governance of it is quite challenging in terms of who owns the laptop, who maintains the laptops, and all that. That's something we have to explore that slightly, but no, we're not there yet.
Okay.
Nowhere near.
Okay, thank you.
That's good that we get that honesty. Can you outline what policy or procedure is in place to ensure that foster carers are given full information about a child's needs before placement?
Yeah.
So we would expect that any child that's going to be placed, that we would share well their information so that the foster carer can make an informed choice. That is required. It is a standard of we would expect for any of our children. The supervising social worker should share the information. The social work team need to share that with the supervising social worker first. That should be part of a dialogue and a discussion about what that means for that particular child and matching with that carer's needs. I think, as Andy said earlier on, it's not been a strength historically in the service, and we would recognise that as being something that needs to be worked on. And there's been a lot of work in place about strengthening matching and making it much more coherent. I don't know if you can add to that, Andy, or whether I've covered it.
I think that's covered it really. Yeah, I mean the placement planning meeting is really crucial, and where you touched on the matching, Donna. We really tried to get detailed profiles of children. We're predicting when children might come into care, so children that are in court proceedings. We're getting profiles ready and to share with foster carers to see if they're a good match or not. So there are things are getting better, but it's some carers would say that they don't get all the information, which is probably true. Not probably, it is true. But it's a work in progress, and I think I'm keen that my supervising social workers chair those placement planning meetings and make sure that carers are fully informed of what the needs of the child are.
We have been doing some work with the social work teams as well, because I think a lot of it's about their skills, capacity about really identifying need and understanding it and then how to articulate that. And I think we've got work to do in that area still. So I think we're seeing that improve a bit, but I regularly get drawn into things about children's profiles or matching or different things. And you can see that there's work to do to strengthen that. How do you balance bringing the child to life, making them real, and sharing the worries without then it becoming a negative list of things. It's a really hard skill thing to do.
Should be focusing
And I
on
think
strength.
social workers really struggle with it because they're trying to balance. Well, I need to say that this is a really big worry, but I don't want to make the child look like they're not matchable and they've got to get that done. I think it's a challenge. So they've got work to do to strengthen practice, really, still.
Yeah, well,
It's getting a bit better.
we're grateful for your honesty.
Yeah.
Have there been occasions though where a fostering has actually been rejected? And we'd like to understand perhaps a little bit more about the primary reasons for those rejections.
So, yeah, that's about referrals where children, schools might highlight issues where they think children are in a harmful place, but then those children do not go into foster care. So, younger children, and then they end up coming in as teenagers, for example.
So not really a fostering question. You're talking before fostering. You're talking. So the children that are at home that are a worry for the school.
That's how I understood the question, looking back at our notes. So there's a lot that it hasn't been. I think it has been the case where a lot of younger children who maybe would have been better off being placed in a safer position with a foster family were not. How many times have these referrals been rejected, and what are the primary reasons? Do you know? Can you give an idea?
I definitely could have given you an idea about how many times. I think if you think of the improvement programme and the I suppose where we are today, and if you go back thinking about the inquiry and where the practice we've needed to change over time, that undoubtedly there will be, when practice isn't strong, social work practice isn't strong, we won't always get thresholds right, and decision making at that point could be quite challenging about when's the right time, when's enough for children, when's the worry enough that you need to intervene. It's not a science, it's quite a complex thing. So when practice isn't strong, people won't always get that right, and then that, I suppose we haven't had early help until quite recently in Jersey's history. There hasn't been a lot of, children in need didn't exist in law until quite recently. If you think back in the UK, it was 89 they made the law around children in need, and here in Jersey, I think we've had it a year or two. So it didn't exist. So it's quite hard to say about getting stuff right or wrong because practice has been a bit different here. So you will look, and I'm looking now, and you see children where you think, actually, we should have acted much more robustly 5 years ago. There wasn't early help then, things didn't get picked up in the same way, and they're coming into care really late, and we are seeing that. It's definitely there. That's a practice thing that's going to take us time to work through, because obviously as our practice gets stronger, the early help investment there's been over the last years, our child in need intervention, as that gets stronger, we are identifying children earlier, we are taking action earlier to try to prevent need rising. That will get better, but I couldn't tell you how many times, because that would be probably an impossible thing for me to define, I think.
Could I just ask a question? Sorry. Andy spoke before about the level of training that is offered to foster carers, so the ADHD, the autism, etc., etc. You've talked a bit about your concerns about children who are kind of edge of care. In order to prevent some of these children coming into fostering, do parents who have got children at home with special and complex needs have the same access to the sort of training that foster carers would have?
It's do you want me to get that?
Yeah.
It's not the same, but we've got, if you the early help offer, I'd say, is really good. So we still need to build on it, but it's really good, and there's a lot of training, Solihull, lots of training courses that any parent could access on the island, the general public can access. It's not probably extensive like you're doing with foster carers. It wouldn't be the same.
I think the children that I'm talking about are children whose families have a social worker, have a children's social worker. So they may be in special educational placement, but parents are saying, I'm really not coping here. And so you're getting those children to edge of care because soon enough the children go, I can't cope with this anymore. And we've had people, in my experience with my autism background, actually crying out for short break service, and then not getting the short break service, but getting offered a fostering placement. And then parents would say, well, actually, if we can't cope as two parents with our child, what is going to be different in a foster family? So that hence my question about, are we extending that training to children of parents who are under a social worker? And have you got any plans in the reform programme to do that, to stop, to support parents keeping their own children in their own home?
So I'd need to go back to look at the extent of the training, but we have got quite a good offer, I think, that parents will get offered. It's not the same as a fostering offer, though. Okay. And there hasn't, I can only be honest with you, there's not been a plan to offer that to parents outside of that fostering offer. I think we would always try, if we thought that a parent was struggling in a particular area and there was something we could do to help, our first option would always be to try and keep those children at home, whatever. So, if that did mean that someone needed something around training, I'm sure that would be something that we would look at.
Okay. And are your social workers aware that is a possibility to offer to their families?
I don't know, I'd say they're aware, but I think they are quite creative and resourceful. So I think generally social workers will come back to the office and ask for things when they want it. We've got a resource panel that people can go to ask for, I don't know if it's a specialist thing you want and you wanted to fund something, that there is a process that they can bring that to, and they go to the panel and the panel will look at that, if that's something we could pay for or not. And that's for children in need, any children, because we always would want, and quite a bit of the reform programme is focused on how to support families to keep children at home, because that's where we need to put our energy and our effort, really. Care should be where we don't want our effort.
Yeah, okay,
thank you. I wonder if perhaps we could have some of that in writing about what's available for those children.
I could get you I think the early help offer's online about the extent of training, but I could ask, certainly,
Thank you.
Yeah, I think this just goes beyond the early help, the early help being almost universal, but...
I think they offer quite a good programme of resource that's online and not online. There's groups and different things. So I think if there was anything out there outside of that, it'd be a bespoke thing, and it would have to be someone would ask and we would look at it. Okay. Rather than we've got a list of that.
Thank you.
Thank you. At the beginning of our hearing this morning, the Minister very kindly outlined the incredible value that foster carers are giving to the whole community. But how can you ensure those foster carers are recognised and valued as essential partners in the fostering system?
Sure. About the foster care event.
Yeah, one of the things we've done is we've organised various foster care events to say thank you to families, and we'll continue doing that. We had the barbecue in the summer. You had the Christmas event.
We got an annual awards ceremony, Black Band, haven't we, Andy?
Yes.
For them this year.
Yeah, on the 12th of December, I think it is, at the Royal Yacht, we've got a celebration event. We've consulted with them because they didn't want, we'd set it up as an awards ceremony. They don't want awards. They want celebrations about, and so we're going to focus on like long service, people who have done, say, even 2 years or something. So we are, we're clearly engaging with them, and there are a number of retention events throughout the year, but also that includes the foster carers' children, because that's just as important as the foster carers themselves. So I would like to think that we do, that they think that we value them. I don't think they do it so much at the moment, but I think we are really trying to get that better. And I think my forums with them and the meeting with the JFCA is beginning to help that. We've had some good feedback from the forums actually around the retention bit.
Yeah.
So positive.
This panel certainly regards that as absolutely crucial. I hope I'm not stepping out of line there by saying that. And how does your department collaborate with educational institutions and healthcare providers to provide a holistic support network for children in care and their foster families? Educational and healthcare.
Could you say that whole question again?
Oh, it's How does your department collaborate with educational institutions and healthcare providers to provide a holistic support network for children in care and their foster families? In other words, your collaboration with education and health.
Do you want me to?
I think
So we have a range of connections, I suppose, if you think we're part of the same directorate, education. So we have the virtual school head, who is obviously the person that's responsible for education for all children in care. It's a whole post that is focused, which does other things as well, but it's a post that focuses purely on children in care and care leavers in that space, so that, you know, that focus is around their education, the links with schools. That, you know, she's quite critical. We've got our focus for the next corporate parenting board on education, learning and development will be the focus of the board to consider about performance. There's a connection with schools through the head teacher forum that I go to that tries to bring that connection together. We've got an education subgroup that's sitting underneath the corporate parenting board, and a health subgroup that's sitting under the corporate parenting board that we've just mobilised in the last 3 months. And both of those subgroups are now starting to be built up of people that are all professionals that are all linked around health and education. There's one for housing and home as well. So, but that's getting the critical people together to drive practice and improvement. There'll be foster carer in there so that they start to really join up practice, so that we are getting the right connection for people's health and well-being, and the support around children's education, the children that aren't getting the offer that they need, how we drive that forward. We've got a looked after nurse role that looks at children's medical needs and their health assessment, the work around across the residential estate in the new reform programme has much more of a multidisciplinary offer. So one of the roles we've put in there is some nursing capacity in the residential estate. CAMS is also into fostering. So that's starting to say, actually, we know that we need these different roles to be wrapped around foster care as the residential estate and children much more as well. So.
And of course, we just passed some regulations in the States this week for Children's Advocacy Service, and a big part of their focus is around the voice of children in educational and healthcare settings. So, you know, that was a fairly quick debate that we had, but thank you for your questions as we went through that. But that's a really important piece of legislation to make sure that children's voices are heard, and we've got a statutory framework around that advocacy service.
Yeah, absolutely, completely concur with that.
Yeah.
Thank you, Chair.
Right. Well, I think that's all our questions, and we are just coming up to the end of our time. So
you've got one more.
I've got one. Yeah,
I think we're
Thank you very much.
It just
Thank you
obviously,
very
I'd like to also impress on, for the record, that the feedback we've had about fostering has been over the period of a couple of years, and this may have felt like that we were doing a lot, asking questions retrospectively, but we do appreciate the fact that things are now moving forward. It's lovely to see Andy in post, and the relationship that you're building with the Foster Carers Association is crucial. The way the panel thinks is crucial, but we are still concerned about a few points: high turnover of social workers, etc. So it's good to hear the ministry is, working on all these issues for us. Thank you.
Yeah. Okay,
Thank you very much.
Thank you.
Thank you.
Thank you.
Very much.
Thank you. Nice to
Thank
meet you.
you.